Welcome back to Psychology of Addiction. I'm also curious as to, I know you have a lot of background in working with families. There are a lot of common traits if you just look at Salvador Minuchin studies on the structure of family therapy. But do you see a lot of common traits in a lot of families with a recovering member or one that you're counseling? I'm sure you see, maybe some challenges and some areas where you can actually really support the recovery process.
The whole idea of how substance abuse has developed over the years, I think, is fascinating because in a real sense, it started out just telling somebody to knock it off and fly right, which was not terribly sophisticated. And then the whole idea of the problem was really the substance abuser, and we needed to deal with them, and everyone else was fine, so we could go ahead and return them to the family and things would be fine. But the enabler, the spouse, was often livid that things had changed, even though they were grateful it changed too. It changed the basic structure. And so eventually we incorporated the spouse into treatment, and then amazingly realized that kids who grew up with people who, parents who were addicted, probably didn't get the kind of parenting that they should have and had very crazy rules that they dealt with, and that they were parentified children on their way to either codependence or chemical dependence. And so bringing them in certainly helped. I think that there really should always be that family component, because if you get the dynamics in the family to change and get the relationships much more authentic, I think you get a better foundation for sobriety.
Yeah, that makes a lot of sense. I mean, you have to have that kind of area of emotional and social support there. I've heard a lot of stories about people who would be in recovery, but the rest of the family would still either be using or still drinking, or not really, not being very supportive. I mean, if you have a family that's not supporting this, I mean, is there anything that you recommend, like referring to another group for more social support? Or
I really think the entire family has to be in treatment. It's similar to the idea of first order and second order change. Stopping a particular drug or chemical is tremendously important, but then you have to learn how are you going to deal with your emotions? How are you going to interact in a healthy way? What can you reasonably expect to change, and what do you have to accept and let go of? The whole spirituality piece in a family. And everyone in the family, whether they're using or not, if they have been exposed to that, really have to work through that issue. And the idea of a dysfunctional family just came out of an alcoholic family. Our entire society is horrendously out of balance.
have you ever encountered instances where you have family members who might be too invested in their person's recovery? Is that even a thing for someone to be too invested in somebody else's recovery?
Absolutely. If somebody has an alcohol or drug problem, it's as if they're having a heart attack. And if somebody's having a heart attack, you're going to focus totally on that person. You're going to forget yourself, and that is healthy and makes sense for this situation. Except that the alcoholic or the drug addict never stops having a heart attack. So eventually, you forget your own needs and get horrendously codependent, and that's a condition in and of itself, but it's intricately involved. My belief is that any person who has an addiction, underneath they have a codependence issue, and underneath the codependence they have a family of origin issue that really needs to be dealt with. And if you don't deal with all of those, I think you get piecemeal progress.
Rather than just putting a Band-Aid on a wound, you'd rather actually find the source and actually try to make some real effective change there. Well, that's all for now, but join us next time and we'll be delving into more information.